Get it, sir.
And then...
And say action.
Action.
Good afternoon. Welcome to Rogue Diabetes. Today we want to talk to you a little bit about how we could have done better as a family, things that we've learned, and what the hospital experience was like for us. So, Abel.
Mom and me were the only ones who ever stayed a night in the hospital.
Yeah?
Mm-hmm. Yep, I got to stay with Abel in the hospital. What did you like about the hospital?
I basically got to sit in a chair all day watching TV.
There you go. We limit screen time here at the house, so that was a treat, right? To get pretty much unlimited screen time. So last week we talked about Abel's symptoms that prompted us to take him into urgent care. And then right away the doctor there recognized that he was in DKA.
Because the kids are probably going to want to get up and move real quick. Abram and Afia, what are some things that Mom and Daddy could have done better for you while you guys were concerned about Abel in the hospital?
Yeah, so just a little timeline. So we went in on a Friday evening, and then Abel and I did not come home until Monday evening. So the younger two were without their big brother for a handful of days.
Anything, Fee? You're thinking, Abram, anything from you? No?
Dad could have let us watch TV all the time.
Oh, the inequality of screen time. Should have seen that one coming.
Abram, anything from you? No? Okay.
No, I think,
You're
I don't
good.
want to put words in their mouths, but they were very concerned about Abel. They made him, crafts and cards. And looking back, I think, just reassuring them in every way that we could that Abel was fine and that, he was going to come home. And, but I think Sean did a great job with it. I think that's a testament to how well Sean did at home, was that the kids, looking back, that was not a traumatic thing that they wish they could redo. So well done.
No.
So Abel, really can you give us one thing specifically that you liked about the hospital or about the doctors? They were all pretty nice. They were all very nice.
And I got to stay in the chair all day.
Yeah, and he got to just heal. His body had been through a lot. I was very impressed. All the doctors, yeah.
I also like that we were able to switch our card right away.
That you're able to what?
Switch our card right away. Now, I keep forgetting I have type 1 diabetes.
So,
You're doing awesome.
you're gonna make me cry, so you guys go play.
Go play.
That was all. Abel, cry in a good way. Love you.
All right, go. Go play.
Enjoy your tea.
Go play.
Okay, Kwang head.
Okay, play quietly. So Sean and I want to kind of flesh that out a little bit more. First really funny story that I would love to share is if anybody knows Abel, you know that he's just the sweetest, most respectful young man. He'd already been poked so many times during his urgent care time that when we were in the ambulance, the EMT asked him, she needed to check his glucose again. So, he's just kind of like resting on the gurney, and she asks him, she's like, hey, Abel, hey, buddy, Abel, hey, I need to check your blood again. What finger can I have? And he just kind of like looked at her.
He totally gave her the bird.
And he just lifted up his middle finger, and she almost died laughing. And I was like, please, I know you don't know this, but like, he has no idea what he just did. And she was like, no, it was totally appropriate. I get it. Like, he's been through a lot already. So just, again, like levity is so important.
Speaking of levity.
Yeah, they take this super seriously. Then we went right into the emergency room. And it just kind of felt like everything like slowed down there. So I think one thing that I could have done better is communicated with Sean a little bit more. I didn't really have any updates, but I think, just anything, I could have done a better job so you didn't have to pull information. From there, we went right into the PICU, the pediatric ICU, and they just worked on getting his glucose levels down. He was at 315 when we went to urgent care, and then just he was stable, but just stabilizing all of his levels, and checking potassium before they could release us to a regular floor. Now that first night that I spent in the PICU, I believe it was the first night, Sean gave us, sent me a link to a TED Talk. Sean went right into research mode. Mm-hmm. So I'll let him actually, do you want to jump in, like kind of what you were going through then?
No, so just lots of praying and reading the Bible. And I went into research mode. I found E10 talk by a gentleman that was very informative, and it just planted a seed about an alternate way, a rogue way of managing diabetes through your diet and through understanding the basic principle of what is really happening to your body. So,
and now that we're figuring out YouTube a little bit more, we can drop the link in.
Yeah, we will drop the link to that comment
and in the description, because that was really the first thing that planted the seed. Like, okay, like it's going to be okay. There have been people before us who have made sense of this, and we looked just at his health, and we're like, okay, that's a path we can take. Let's find out what he's doing.
And so that seed was planted, but it didn't really sprout for a while. So we were just so, again, relieved to know that there was an answer. We knew it was going to happen. It was something we were going to get to bring him home from the hospital from. Mm-hmm. That when we went through the education part of it, nobody really talked to us about the complications. No one actually talked to us at all about the complications. And we went to a very good hospital. Again, not disparaging anyone in the medical community. We're not doctors, just going through it for us. We want to know everything we can, and things started to not add up during that training. We weren't talking about the complications. We were given a very rudimentary plan that just seemed very cookie cutter and not specific to Abel.
Yeah, like with the complications, our first hint that like we're not being told everything that we want to know. Like we're just like we want to know everything, and then from there we can make a plan. We were told that Abel would have to see an ophthalmologist, not an optometrist now, that he needed to see an ophthalmologist because he's at a high risk for retinopathy. And it's like, okay, so you're gonna tell me that I need to go start seeing specialists, but tell me why, and then tell me how we can avoid that. Those were the connect the dots that we had to make ourselves. So it's like, okay, like at some point you'll need to start seeing these specialists, but don't worry about it until he's a grown-up. And then we started talking to other people and doing our own research. And kids are not immune to the complications of diabetes. They just don't necessarily start showing up until, differs for every kid. Who knows how many years down the path. And that's what we are trying to avoid by going low carb immediately. One of the clues, in addition to them telling us that Abel needed to see an ophthalmologist, was that a psychologist came and spoke to him a couple times, and then he also had one follow-up appointment with them. And while I absolutely appreciate them giving like a complete holistic support from the beginning, a lot of research points to people with uncontrolled diabetes or not well-managed diabetes are at much higher risk for depression. And so that's why we were given the resource of the psychologist right away. Now, again, that was one of those things that we were not told that at the hospital, but through our own research, we discovered, this is a complication we want to avoid. Again, one of those like, okay, why are they offering this without connecting the dots for us as to why this is important? So I remember thinking shortly after, like, all of these resources are given to us. Diabetes is clearly a serious, something we need to take seriously. But I felt like we weren't being told to make changes. Like it was almost like we weren't being asked to take it seriously. Whereas, like tell me what I need to do to avoid the complications and I'll do it to a T, but give me a chance. So again, through our own research, we've been able to make a plan that we feel confident in.
Yeah, absolutely. And there's so much information when you start really looking for it to try to find what truth is can be quite challenging. So again, very, very thankful to Dr. Bernstein and people that have put his research, and thank you for persevering, good sir. If you ever see this, and offering an opportunity and a way of managing diabetes that is
proactive.
That's proactive and does give a person with diabetes recognize that they have every capability and every right to have a normal blood sugar, and that is well within the realm of possible. So thank you. Questions that I wish we would have asked, or that I wish we would have known to ask. We wish we would have known to ask. There are so many, and every day we realize there's just that much more we don't know. Because that seed was planted about a different way of managing diabetes, it didn't really click that something wasn't adding up during the education before we were released and discharged to go home. But I wish I would have pressed the issue more on, one comment was directly made to us, carbs are good.
Have to have carbs.
You have to have
burn,
carbs.
yeah.
And we were given an overly simplified, generic cookie cutter diet or regimen to follow. And that just seemed a little off, but we didn't know enough to question that. And I wish we would have questioned that. Like, well, where's your research? I wish I'd have said, hey, where is your research? Can you point me to a medical study? Can you give me some information? What medical journal should I read? Where did you learn that? And start comparing notes then and start questioning in a respectful way.
I mean, you have to become an expert in your child's diabetes. So you're not just a parent who, does a, checkup every once in a while. You're managing and making decisions, very, very important decisions, 24/7. So you're more than just like a patient's mom at that point. Like you have to become capable of taking over it completely. So it's, it's a different relationship than an annual checkup. Two more things that I just want to cover as far as like the diet. The diet that Abel was offered was abysmal. He was told, sorry, just to be, it's a great word. It was abysmal. He was on a low carb meal plan, so we could choose from the menu and could go up to 60 carbs at every meal. And then he could have 2 snacks at any point during the day, up to 15 carbs, and we did not have to cover that. It makes me sick to my stomach to think of what that was doing to his blood sugars. He was not on a continuous glucose monitor at that time, so I don't know. And I will say that as a mom, Abel had been very sick. Honestly, I let him choose foods that we had never given him before, because I was so grateful that he was eating. The kid had Rice Krispies, which he had never had before. We've mentioned before, we ate pretty paleo prior to diagnosis. Then we've had to tighten that up a lot. His body cannot metabolize carbohydrates, and 60 grams is an obscene amount for a child to intake. And then we've learned since then also there's really no such thing as an uncovered, a free snack.
There is no cheat.
Everything needs to be covered. 15 grams of carbs at a snack is more than he intakes right now in 2 meals. And we were giving that to him uncovered. So it really just set us up to be very confused as far as the precedents that had been set in the hospital, and what we were learning in our research outside of the hospital setting. Last thing, like being the parent that was in at the hospital, I would really recommend taking over those injections as soon as you can. There is a technique to injections that will make them painless, and Abel sometimes doesn't even know I'm already done with the injection. Sometimes I get it wrong, and he feels it. And don't assume that your nurse has that technique down. So do a little research on your own. In the hospital, they were pricking him right on the pads, and we know that nerves are in there. So take over as soon as they will let you, to get comfortable, because you got to take it over as soon as you leave the hospital.
All right, that's all. I hope this video helps. God bless y'all. Have a great day.
Seriously? What was that even? I'm getting the purple finger pokes, right?
Red ones.
The red ones? Are you sure?
Red and white.
Why the red and white?
It hurts the least.
It hurts the least. All right.
Because it doesn't feel like a thing.
Gotcha. Okay. How did mommy do on the insulin shot?
Good.
Yes. Thumbs up?